OOD2 PBL Group F. The situation is that a 33-year-old computer graphic designer wished to have a new lens design. From the reflection, we discover that she is suffering the onset of the presbyopia. And this is the question that we want to focus on, is that how can we ensure her ocular and mental health are well cared? As we know that she is suffering from presbyopia, and sometimes it may be hard to adapt to it. Sometimes it may be hard to psychologically accept the fact of presbyopia because sometimes it sounds like that it's getting very old, especially when we had an unfriendly Cantonese translation of presbyopia. As a professional optometrist, mental aspect of the patient should also be cared. Actually, there are quite a lot of common misconceptions about presbyopia, such as is the onset of presbyopia is the sign of getting old? Is the visual system start to decay because of the onset of presbyopia? And would it have any impact on the ocular health? So let's talk about some common knowledge of presbyopia. We all know that presbyopia blurs us when we are doing near work as we age. It's due to the loss of angle of accommodation, due to the hardening and loss of elasticity of the lens. And it's just a normal physiological change. We should assure to the patient that it is not really a sign of getting old. Moreover, we should inform the patient that it does not worsen infinitely. Usually, the progression of presbyopia would stop at around 60 years old. And last slide, we have just taught the reason why it makes us blur is due to the loss of elasticity and hardening of the lens. But actually, this phenomena starts to progress since our childhood, and it is not really the sign of getting old. And it don't have anything to do with the health of the eye. So talking about the ocular health, I would also want to emphasize the importance of regular eye tracking, and it is commonly neglected in Hong Kong. As we all know, age is the risk factor to many sight-threatening diseases such as AMD, glaucoma. Those diseases are usually asymptomatic in their early stage, and checking is needed to rule out any underlying pathologies.